Are you confused about the splitting of heart sounds? Here is the easiest way to remember that. Second heart sound is made up of two valve closures. First is aortic and the second is pulmonic. During normal inspiration, more blood returns to the right side of the heart. This relays the closure of the pulmonic valve. So A2 happens first, then P2, creating a normal physiological splitting. Wide splitting occurs in the conditions that delay the right ventricular emptying. So P2 closure is delayed further, thus exaggerating the normal physiological splitting. This happens in the conditions like pulmonary stenosis and right bundle branch block. Fixed splitting is classical for atrial septal defect. There is a left to right shunt, increasing the pulmonary valve closure time, and the breathing has nothing to do with the split. Paradoxical splitting means the split appears during expiration instead of inspiration. So P2 occurs before A2. This happens in conditions that delay left ventricular emptying. Examples are left bundle branch block or aortic stenosis. Follow our page for more high yield content.